Have you ever struggled to serve a patient with dental trauma from a different background? Have you ever felt frustrated trying to communicate with diverse populations dealing with dental trauma? As the U.S. becomes more diverse, it's crucial to know that racial and ethnic minorities often face higher rates of dental trauma and worse oral health outcomes. Hi everyone, I'm Marissa, RDH Alternative Practice and Birth Ambassador. Today we're going to talk about an important topic: how to create a welcoming and safe space for patients who have experienced dental trauma, particularly in Black, Latin, and LGBTQ communities. First, let's define the term you need to know: ACE, or Adverse Childhood Experiences. These are traumatic events that occur during childhood, which can significantly impact an individual's health and well-being, including their dental health. So how can we, as dental professionals, create a safe space for these patients and help prevent negative experiences? Let's break it down. Number 1, cultural competency and sensitivity training. Step 1 is to ensure all staff are trained in cultural competency and sensitivity. This means understanding and respecting the unique needs of Black, Latin, LGBTQ, and pediatric patients with dental trauma. Here is a link from the U.S. Department of Health and Human Services where you can gain knowledge and receive continuing education credits. This course is free for all dental professionals. Step 2 is to create an inclusive environment. Decorate your office with diverse artwork and materials, provide multilingual support, and display signs indicating your support for LGBTQ patients. Ensure all forms use inclusive language. I especially love this sign from this dental office. It is welcoming and it's colorful and it's really inclusive. To provide inclusive care, oral health professionals should understand the community's terminology and note the medical and dental disparities faced by these individuals. Awareness of their own implicit bias and consideration of the patient's past medical and dental experiences may impact the dental appointment. Number 3, trauma-informed care. Step 3 is trauma-informed care. Train your staff to recognize signs of dental trauma and approach these patients with empathy. Allow patients to have control over their treatment, explain procedures thoroughly, and provide comfort items like blankets or stress balls. I spray lavender oils on the bibs to relax the patients when I can feel their anxiety and fear. Step 4 is community engagement. Partner with local organizations to provide education and resources, and create avenues for patients to give feedback on their experiences. One place I always go back to is the local Boys and Girls Club. If you haven't yet, we recommend checking them out. Step 5 is to offer specialized services for children, design child-friendly waiting and treatment areas, use behavior techniques to ease anxiety, and encourage parents' involvement during treatments. Step 6 is to ensure accessibility. Make sure your clinic is physically accessible to people with disabilities and offer flexible payment plans and assistance with insurance. Finally, Step 7 is positive reinforcement. Implement recognition programs, reward patients for their bravery and cooperation, and follow up with them after their visits to show you care. By following these steps, you can create a welcoming and supportive environment for all your patients, helping to alleviate dental trauma and promote overall well-being. Thanks for watching, and let's continue to provide the best care possible for our diverse communities. For more tips and information, don't forget to subscribe and follow us on social media. See you next time.